What is the process of going through a procedure for something like erectile dysfunction? What would that look like? If I were to come in and go through that process, what can they expect?
The first thing that's going to happen is you're going to sit down with the medical doctor.
Right.
Okay? A medical doctor is going to see you. The first thing that happens is they'll get a broad-based understanding of how you got to where you're at. So that takes a little bit of time, and that's the most time-intensive part of it, is really trying to tell your story and understand your story so that we can intervene and help you the best we can. After that, you and I will put together a plan,
Right.
a diagnostic approach that may involve ultrasound, it may involve a testing procedure geared towards your situation, it'll involve body composition analysis, it'll involve laboratory testing,
Right.
and additional follow-up. And at that point, we're going to come together, put our heads together, and really find the appropriate plan for you specifically. It'll be very individualized in our approach, and it usually involve multiple aspects. For instance, weight may be an issue, and obesity may be an issue for some of our patients that may come into play. We may discover some emotional issues that may need to be addressed and that may come into play. Hormonal problems may need to be addressed. Medications may be part of your repertoire in terms of what you may be going through with us. So we'll outline all that and really try to find a path towards success, consistent success. I can remember just a few months ago, a 35-year-old gentleman just had his second child. He and his wife were very concerned because they both recognized that their sexual health had really deteriorated. A lot of times, unfortunately, men come in sort of kicking and screaming, but the wife is bringing him in by the earlobe saying, hey, we got to deal with this now. But what we found out when he came in, and of course the wife was present too, which I really encourage the patients, if they're willing, is to have their wife come in as well. I was able to point out, number one, that it wasn't her fault, and it was something that we had to work out, and this was a real medical condition. We were able to find, he was recently placed on antidepressants that weren't really necessary. Turns out that the antidepressants were related to his hormone dysfunction, and they went away as soon as we started him on TRT, testosterone replacement therapy. We also found out that his erectile dysfunction was very much part of an overall decline in his health. He was gaining a lot of weight. He had recent change in jobs, a recent child involved. All this led to a lot of stress in his life, and it's really easy under the circumstances to find the sexual health will begin to deteriorate. He was able to lose weight. He was placed on testosterone replacement therapy. We gave him some support for his sexual health. The relationship completely turned around. Now he's not requiring any medication for his mood or for his erectile function, and he is a happy camper still with our program. There's a lot of things we have to offer besides erectile dysfunction treatment. Right. But that was a very usual case. A younger gentleman having some signs of erectile dysfunction, not really sure what's going on, able to reassure the family and get him back functioning again.